Nursing chose me, and I remain committed to choosing it right back every single day. COVID-19 has heightened the awareness of the many contributions that nurses make and has shown us the significant impact that nurses have within the community. When the call was made, a lot of us answered. Working on the front lines of COVID in New York City was an experience that did not necessarily alter the way that I practice. Instead, the spark that existed inside of me became a wildfire. It was the most difficult yet meaningful work that I have done. Every day, I look forward to going to work and fulfilling the promise that I made to the patients, their families, and the profession. It was part of my job to ensure that I was not so wrapped up in tasks that I failed to remember to foster human connection, compassion, and empathy. Nurses around the country quickly adapted during this challenging time and dominated the many roles of nursing with strength and grace. Nurses are many things. Nurses are experts, innovators, researchers, financial managers, problem solvers, advocates, and most of all, nurses are leaders. With leadership comes great responsibility. The responsibility of nursing does not begin and end at the bedside. We must be present at the bedside during each and every direct interaction with patients and in the boardrooms if we want to work to bridge the gap in racial disparities that exist within our healthcare system. My involvement in advocacy stemmed from advisement from my mentor, who is now deceased. He was able to recognize leadership qualities and my passion for advocacy before I was able to see them within myself. I recognized the importance of advocating on behalf of patients and the profession shortly after attending meetings held by my state's professional organization, then later going on to attend a policy summit in Washington, D.C. for nursing students. Simultaneously fighting on the front lines of COVID-19 and racism is the reminder that it is necessary that we are present and vocal now more than ever. During this critical time in our nation's history, racism has been declared a public health crisis. Current events have been referred to as a pandemic within a pandemic. Witnessing African Americans brutally killed on news outlets around the world has been harrowing to experience day after day. When George Floyd called out to his mother while a knee was obstructing his airway, mothers around the world were summoned. Cori Bush, a registered nurse and U.S. congressional candidate, recently stated, "Many of us did not choose to become activists. We were activated." As a black nurse, a black woman, and a black mother, I quickly became one of the many that she was referring to. African Americans often feel unseen and unheard in the healthcare community, and based on the statistics, it is time that we open our hearts and open our ears to listening. African Americans have higher rates of chronic diseases such as hypertension, stroke, and diabetes, and are likely to die at a higher rate as a result of that. These are pre-existing conditions that complicate COVID-19 recovery. Additionally, African Americans die from COVID-19 at a rate of 2.1 times higher than that of their white, non-Hispanic counterparts. Serena Williams, a tennis star with an abundance of resources, was very vocal about her terrifying experience during childbirth. Black women have the highest maternal mortality rate and died at a rate of 3.2 times that of white women between 2007 and 2016, according to CDC surveillance data. After mothers have their babies, we must know that the infant mortality rate for African American mothers is higher than that of any other racial group. There are countless research publications that address the inadequate pain management for African American patients and the role that racial bias plays. Dr. James Marion Sims, referred to as the father of modern gynecology, conducted operations and experiments on enslaved black women under the premise that they could not feel pain. As members of society, it is imperative that we maintain a high level of self-awareness. If you support White Coats for Black Lives and or the preservation of black lives, I would like to challenge you to explore what this means to you. How can you build relationships within the black community, particularly since there has historically been a level of distrust toward medical professionals for various reasons? Take the time to delve into the story of Henrietta Lacks and the Tuskegee syphilis experiment. Explore the meaning of implicit bias and how it influences the quality of care that African Americans receive. I would also encourage you to explore the stereotypes that you may subconsciously believe. Lastly, how will you amplify your voice to advocate on behalf of African Americans even when it is uncomfortable for you? Racial bias is killing this community at an alarming rate, and this has gained more visibility during this pandemic. This is a problem that nurses cannot solve alone. We must all commit to dismantling systemic racism in healthcare and within our communities. Thank you.